Thank you all. Thank you, thank you. Please remain standing. Oh, sorry. As Barbara and I can attest to, it's about 40 degrees hotter up here than it is in there. Barbara, thank you for your leadership, for your gracious words, and for everything you do in this existentially important endeavor. I also want to thank the First Lady. Married next month for 31 years. We've known each We've known each other for 38 years. For some reason, it took me 7 years to ask her out on a date, but that's not for today's discussion. But today's groundbreaking simply would not be possible without her years of tireless dedication to improving maternal and infant health. And I think the work in this space will go down as one of the greatest sets of accomplishments of our administration. It will be a legacy that I believe will live on for generations. And it will be a legacy reflected in the lives of the families who will now have the chance to thrive because of your work and the work of so many with us today, and that this center will transform maternal and infant health care. I also want to thank someone who we're going to hear from in a few moments, the President and CEO of the New Jersey Maternal and Infant Health Innovation Authority, Lisa Asari. Lisa, thank you and your team for everything you have done to get us to today. I'm also grateful to the New Jersey Economic Development Authority team and especially its Chief Executive Officer, Tim Sullivan, for helping make this a site that will transform every aspect of maternal health across our state. There is literally an all-star lineup of really important people with us today: healthcare experts, members of clergy, philanthropists, corporate representatives, higher education representatives, members of our cabinet. To each and every one of you, I say thank you. To the elected officials, we won't hear from him, but I want to thank our host, Mayor Reed Gaciora, for everything you do, Reed. Assembly members Wayne D'Angelo and Anthony Varelli, thank you, gentlemen, for everything you do. And we will hear in a few moments from Trenton's own Senator Shirley Turner and Assemblywoman Verlina Reynolds Jackson. Thank you, ladies, both. And I want to say a particular shout out to Stephanie Lagos. I can say beyond the shadow of a doubt we would not be here, Steph, without you. So God bless you. So just last month we marked the difficult anniversary of the U.S. Supreme Court's decision to overturn Roe v. Wade, a decision that in one stroke stripped away a fundamental right and undermined decades of progress for women across America. Unlike the U.S. Supreme Court, we here in New Jersey will always defend reproductive freedoms. But defending reproductive freedoms is about more than just rights that we are proud to have codified into state law, and we are. It is also about ensuring that every woman has access to the full spectrum of care, from family planning to safe pregnancies to healthy births and beyond. This is necessary work because, as most of you are sadly aware, the United States has the highest maternal mortality rate of any developed nation. And when I first took office, our state had the fourth worst maternal mortality rate in the entire country. The weight of this crisis falls hardest, as Barbara alluded to, on Black and Latino mothers and babies who are far more likely to face complications, inadequate care, and devastating outcomes. Tammy knew that that was simply unacceptable. So did all of you. So she and we got to work. She enlisted national experts as well as mothers themselves to help us design our Nurture NJ maternal and infant health strategic plan to completely rethink how we care for mothers and their babies. Since we launched Nurture NJ, I've signed more than 70 maternal and infant health reforms into law. And again, they don't get to my desk without great leadership in the legislature. Thank you again, each and every one of you. Some of those steps include codifying the right to doula care in a hospital or birth center, creating innovative programs like Family Connects NJ, which is the nation's most robust universal nursing home visitation program, and more. All in all, we have invested millions of dollars into programs that support moms and babies. And thanks to these efforts and the support and collaboration of our thousands of Nurture NJ partners across the state and country, many of whom are represented today, New Jersey's maternal mortality rate has moved from the bottom of the pack into the middle of the pack. We still have a long way to go, but the work continues here today with this groundbreaking, and we will not stop until every family gets the care they deserve. And where better to set our sights on transforming maternal and infant health care than right here, Reed, in Trenton, and right here in New Jersey. This is for Trenton, this is a classic make and take, right? For New Jersey, we've always been the state of innovation, from the light bulb to the first at-home pregnancy test. Some of the world's most important inventions started right here in the Garden State. Since the start of our administration, we've been busy establishing strategic innovation centers across the state to continue our state's tradition of discovery and progress. These centers bring top talent, cutting-edge resources, and key public and private partners under one roof to drive meaningful change. And today we can announce the exciting news that the Maternal and Infant Health Innovation Center, or the MIHIC, doesn't exactly roll off the tongue, will be home to our state's 12th Strategic Innovation Center, the MedTech Strategic Innovation Center. I want to thank Rowan University, Tony, and Plug and Play for partnering with the Maternal and Infant Health Innovation Authority under Barbara's and Lisa's leadership, and the Economic Development Authority under Tim's leadership to make this possible. Their collective leadership and collaboration will help ensure this new center reaches its tremendous potential. And with this addition, the MIHIC will be more than just a center of care. It will be a one-stop hub for transforming maternal and infant health, from shaping better policy to training providers to delivering world-class care. This center will help us close gaps, tackle disparities, and build a healthcare system that works for every mother and every child. And it will most certainly be a place that saves lives. It will give families hope, and it will show the rest of the country and the world, indeed, what's possible when you put people first. So to everyone who's been a part of this journey, thank you. This is your victory, too. We are not just breaking ground today. We are building a future where every mother and every child in New Jersey gets the healthy start they deserve. Thank you all so much. And again, we are not here today without the singular leadership of one person in particular. Please help me welcome the great First Lady of the great state of New Jersey, Tammy Murphy.
No, please stand, just as Phil said. Thank you. Good morning, everyone. I have to say I really can't believe we're here. Standing before you today on this site with so many of you who have walked alongside us. I'm really filled with pride, gratitude, and a lot of emotion, actually. What a moment and what a day. This isn't just a milestone for Trenton or for New Jersey. This is a transformational day for every mother and baby who deserves a safe, healthy, and strong start to life. Nearly 8 years ago, we launched Nurture NJ with our urgent goal to make New Jersey the safest and most equitable state in the country in which to deliver and raise a baby. At that time, as Phil just mentioned, we ranked 47th in maternal mortality rates out of 50. Black mothers were more than 7 times likely than a white mother to die from maternity-related complications. That was heartbreaking and unacceptable, so we got to work. We didn't start with policy, we actually started listening. We traveled the state, visiting hospitals, homes, and houses of worship. We sat with mothers who had lost babies, with families who had lost mothers, and advocates who never stopped fighting. Their stories, indeed your stories, shaped a movement grounded in truth, equity, and determination. Since then, we've passed more than 70 laws focused on maternal and infant health. We've brought communities together through family festivals, connecting vital resources to over 16,000 families. Through Family Connects NJ, nurses have made close to 5,000 home visits to new parents, offering care and reassurance during those first few critical weeks. Our leadership summits have gathered thousands, from hospital CEOs and elected officials to doulas and moms, building bridges and finding solutions. And we've completed or made headway on more than half of the over 80 recommendations in our Nurture NJ strategic plan. And the list goes on. All of this led to something lasting, the creation of the Maternal and Infant Health Innovation Authority, ensuring maternal health remains our core focus for New Jersey for generations. And since 2018, just look at what we've achieved together. From 47th to 28th for maternal mortality, from 5th to 2nd for infant mortality, from 6th to 1st in neonatal mortality. That is collective commitment, and that is real progress. And now, the center. Today, we break ground on the Maternal and Infant Health Innovation Center, the heartbeat of Nurture NJ. It will save lives, raise standards, and show what's possible when equity leads. Shaped by the voices of families and rooted right here in Trenton, this center will deliver care and collaboration like never before. It will provide comprehensive clinical care, wraparound support, and serve as a training hub for a workforce that reflects the communities it serves. It will also house a cutting-edge data collaborative to keep learning and improving. And it will become the nation's first strategic innovation center focused solely on maternal and infant health. The anchor tenants will include Rutgers, led by the Rutgers School of Nursing, with a statewide coalition of higher education institutions, Capital Health, and the Trenton Health Team. These partners bring together academic, clinical, and community expertise to improve outcomes for moms and babies. Thanks to over $23 million in new investment, the New Jersey Economic Development Authority, alongside Rowan University and the world's biggest accelerator, Plug and Play, will transform the top floor into an innovation engine. Startups focused on maternal equity, health tech, and more will build solutions right here in partnership with this community. We're not waiting for change, we're creating it right here. Why here? We chose the Battle Monument site with purpose. It's a place of history, strength, and access, near NJ Transit, green spaces, and trusted neighbors like Greater Mount Zion AME, Salvation and Social Justice, and the Henry J. Austin Health Center. Just as mothers anchor our families, this center will anchor the community. To Dr. Barbara George Johnson, thank you for your wisdom and belief in this work. To Tim Sullivan and the NJEDA team, Mary, Tara, Kathleen, and just so many others, thank you for turning bold ideas into action. To Merck, through its Merck for Mothers initiative, Dr. Heather Shaffey, Randy Tepper, Amy Towers, and all joining the Maternal and Infant Health Innovation Fund, your commitment will literally change lives. To Lisa, our visionary leader at the Maternal and Infant Health Authority, thank you for your dedication and direction. And to every advocate, policymaker, nurse, doula, and parent, this center is yours. To my day partner in crime, Stephanie Lagos, thanks for helping you and the team. We couldn't have done it. And importantly, needlessly, I want to thank Phil. Thank you for being my partner always, and particularly in this project. Thank you for your steadfast leadership on behalf of New Jersey's families. I've watched you time and time again and seen how you fight for those too often left behind. The progress we celebrate today stands on the foundation that you laid, and I, on behalf of so very many, are incredibly grateful. So to everyone here today, you're not just witnessing history, you're helping shape it. This is a turning point, a promise that every mother and baby matters, their lives, their voices, and their futures. So let's keep going. Let's build, let's innovate, and let's lead. Because when we invest in mothers and babies, we invest in our shared future. Thank you. And now let's make history together.
Tammy, thank you. Thank you for your leadership. Just an extraordinary journey that we're on. And I think you've gotten the impression already, we're not patting ourselves on the back. We've made a lot of progress, and we have a long way still to go. This is an all-star lineup of outstanding leaders today. Please help me welcome another one, the President and CEO of the Maternal and Infant Health Innovation Authority, the one and only Lisa Asare.
Good morning. Governor, it's true, it's very hot back here, very hot. I would say 60 degrees hotter than over there. But thank you for joining us on this momentous occasion. It's an honor to stand here today with so many of our partners, community members, and leaders to celebrate a significant and much anticipated milestone. As it's been said, it's surreal. I've had a couple people pinch me this morning to say to me that this is really happening, you're really here. Because today we're not just breaking ground on the new Maternal and Infant Health Innovation Center, we're laying the foundation for the future. We are laying the foundation for the future. This is where vision meets action, a moment where years of hard work from so many dedicated individuals comes to fruition. I'd like to first thank Governor Phil Murphy and First Lady Tammy Murphy for entrusting me with the leadership of the New Jersey Maternal and Infant Health Innovation Authority, the nation's first state authority dedicated to improving maternal and infant health outcomes and reducing disparities. As a mother of 3 children, all born here in the city of Trenton, when Capitol Health was on Bellevue Avenue around the corner, this role and this mission is both personal and truly the honor of a lifetime. Thank you. NJ MIA builds upon First Lady Tammy Murphy's Nurture NJ initiative, and our mission remains unwavering in our commitment to ensuring that New Jersey becomes the safest and most equitable place in the nation to have a baby and raise a child. NJ MIA will lead the charge in coordinating, promoting, and implementing initiatives that uphold best practices, serving all families with dignity and respect. The center to be built right here where I'm standing represents a beacon of hope and change for all mothers and babies in New Jersey and across the nation. New Jersey has become a model that other states look to, and it's truly an honor to have this center built right here in the heart of Trenton, our vibrant capital. We know we can't do this work alone, and that's why we're proud to share this responsibility with our 3 lead anchor tenants who are here today: the Trenton Health Team, Capitol Health, and the Rutgers School of Nursing, which will be working alongside a consortium of academic partners, including Mercer County Community College, Thomas Edison State University, Stockton University, the College of New Jersey, and Princeton University. As you can see, This work is no small undertaking. The work that lies ahead is immense and cannot happen in isolation. Systemic change requires the dedication and courage of individuals who share a common mission. To reach this moment, teams have invested countless hours and effort, and this center stands as a testament to what we can achieve when we come together and work as one. With that, I'd like to close with acknowledging and thanking the Governor and First Lady's teams, our esteemed NJMIA board members, including our board chairwoman, Barbara George Johnson, for your leadership, our partners at the New Jersey Economic Development Authority, the John S. Watson Institute for Urban Policy and Research, our state legislative partners, and my small but mighty team, some of whom are here today in the audience. Thank you for helping me bring this vision forward, often flying the plane and building it at the same time. Today, as we break ground, we're not just starting a project, we're opening the door to a future filled with hope, love, compassion, and better health for all mothers and babies. We can do this, New Jersey. We can do this, Trenton. We will show the world what is possible when we all come together. Thank you all for being here, and thank you all for your commitment to this work.
Lisa, thank you, not just for those great words, but for your leadership. And for those of us like myself who were new to this struggle and journey when we started, Lisa said something that I think is important for all of us to keep in mind: having a baby and raising a child. When you hear the word maternal and infant, you think of the moment of childbirth, that 24-hour period. This is a much wider aperture that this center has been and will continue to address. Lisa, thank you for everything. I mentioned an all-star lineup of legislators. We're incredibly proud to hear, as we round things out, from two of Trenton's own. Please help me welcome another great leader, Senator Shirley Turner.
Good morning, everyone. No, this is more than a good morning. This is a great morning, not only for the city of Trenton, but for the state of New Jersey and for this country, for what we're here today, breaking ground on something that the entire country, the state, and the city of Trenton will benefit from. And I think it's appropriate that we're located right here near the Battle Monument, because that's where the Revolutionary War changed the course of our history. And I know that this facility is going to change the course for maternal and infant health in the state of New Jersey as well as for the country. So thank you all for being here. This is a great day, and it just reminds me of that old African proverb. It takes a village to raise a child, but it also takes a village in order to provide maternal and infant health. And all of you are part of that wonderful, magnificent village. I remember, Tammy, when we used to meet so regularly at Drumthwacket, you involved us all in the creation of your dream. And I thank you for your vision and your unwavering leadership in bringing this project to fruition. It takes a woman in order to make these things happen. But Governor Murphy, we couldn't have done it without you and your magnificent team of administrators. And I want to thank also my running mate, my colleague, Assemblywoman Reynolds Jackson, for carrying the ball in the Assembly and getting this done. Also, I want to thank my running mate, Anthony Varelli, who helped bring this to fruition, along with our other colleague who is helping to build this dream, Assemblyman D'Angelo. So this is a great day, and we're all entitled to celebrate, and I can't wait to get my shovel. Thank you.
don't know where we'd be without you, Shirley. Thank you for everything. Two things. One is this is being built with a project labor agreement. So, Wayne, to you and your brothers and sisters in labor. Very happy to say that. Tim, thank you for that. And Shirley mentioned the battle monument. New Jersey is taking its rightful place in the story of our revolution and nation birth. So check us out at revnj.org. More battles were fought in the state of New Jersey than in any other state in America, and we're now finally reasserting our place in that story. So Shirley, thanks for reminding us of that as well and for your leadership. Shirley mentioned her. Please help me welcome another extraordinary leader speaking on behalf of her great assembly colleagues, Verlina Reynolds Jackson. I always want to say Trenton's only.
Thank you, Governor. So you all know me. I'm percolating and I'm my heart is pounding so hard right now. And that's because I'm just excited. You know, when I think about all the work that Mia has done, I need to give some of my energy to you. So when I say Mia, you say equity. Mia. Equity. When I say Mia, you say Trenton. Mia. When I say equity, you say love. I think when we think about all the work that's gone into this project, we are surrounded by healthcare, equity fighters, defenders, and allies today. And this is a powerful move for our community. This is a moment for mothers and fathers and families and babies, and for the future of maternal health care right here in the capital city of Trenton. I'm from Trenton. I live here. We've talked about this. Mayor, this lot has been vacant for over 30 plus years. We are able to finally do something with this space, but not just doing to do. We're doing it to save lives. And so I want to thank Chairwoman Shavonda Sumter of the New Jersey Legislative Black Caucus, to our amazing First Lady, Tammy Murphy. Your Nurture New Jersey initiative has lifted the narrative and elevated the urgency and brought all of us together under one bold goal, and that's to make New Jersey the safest, the most equitable place in the nation to deliver and have a baby. Thank you to Governor Murphy for supporting this vision and investing over $50+ million for our families and making maternal and infant health care a top priority in the state. Thank you to the Maternal Health Care and Innovation Center. This is truly a gift for the capital city. And to the incredible women, the women that are leading the charge, to Dr. Barbara George Johnson, to Lisa Asaris. I can't leave out the Trenton Health Team. All of these things are local. We've talked to the families. We've heard their stories. We know about the barriers in health care. I want to thank Henry J. Austin, our County of Mercer, our County Executive Dan Benson, to Capitol Health, to the Trenton Housing Authority, to all those that are going to be coming here for maternal and infant health care. We couldn't do this without you. This groundbreaking is really the answer to the call. And so we can't celebrate enough. But the work that has gone in has truly, truly, truly been hard. First Lady Murphy, you know from the time that we started working, when we had those roundtable discussions, from all the work through Nurture New Jersey, this doesn't just happen overnight. This is years and years and years in the making. And this is what good government looks like. So I say thank you, and I look forward to all the work that we will continue to do together.